South Africans no longer have to race to get home before midnight. A curfew imposed at the beginning of the coronavirus pandemic was finally scrapped ahead of New Year's Eve. Now, nearing the end of the fourth wave, the country's scientists have more good news about the latest variant, Omicron.
We see about a 25% lowering of the risk of death, so about 1.3 times lower risk of death. And so that makes us think that that residual effect, that 25% reduction, could be the true effect due to lower virulence of the Omicron compared to previous variants.
The reduction is compared to the previous Delta variant, which was more severe than the original virus. The study, which has yet to be peer-reviewed, found Omicron to be similar in severity to the first wave. Davies says a major difference now is prior infections and vaccinations help reduce hospitalizations and deaths. While Omicron evaded vaccines and reinfected people, scientists say that's not necessarily a bad thing.
It's going to boost immune responses in people that were previously infected. It's going to boost immune responses in people that have been vaccinated. And it will also result in further immunity in people that haven't been previously infected or vaccinated up until now. The data is quite compelling that people that have this hybrid immunity, vaccine together with infection, in fact, they probably got a better immune response.
Scientists emphasize getting the virus is no substitute for a vaccine. Death rates remain highest among people who aren't inoculated. Official government figures say over 93,000 lives have been lost. And getting sick has other consequences.
But even a mild variant can cause a lot of chaos for a health service. For a number of reasons. The one is with these very high transmission rates, you get a lot of people infected at any one time, and that includes healthcare workers. And so that means that you've got a lot of people who are off work and often their contacts needing to be quarantined, and that can have huge impacts.
Still, the promise of less stringent protocols is welcome to businesses hurting from nearly 2 years of curfews and lockdowns.
There was a big conversational point on the 28th of December where do we stay closed or do we reopen? And the reason we reopened was these extra 3 hours. We do believe that there has to be a brighter day coming, yeah.
Whether increased immunity amid fewer restrictions will be enough to ward off the worst effects of the coronavirus will be tested by future variants. Linda Givetash for VOA News, Johannesburg.